Hi everyone, this is Dr. Madhuri from Team MDS Conquer. I think everyone has given exam yesterday and few questions in the paper are tricky and lengthy and which are based on diagnosis. So today we'll discuss on the radiology questions in yesterday's paper. Going into the question, in this question, it is given as the condylar head as a typical toadstool appearance with marked flattening and apparent elongation of the articulating condylar surface. And there is also an inclination of condylar neck. So you have to see this question is completely based on radiological diagnosis. Here it is given as a typical toadstool appearance. You can see in the picture, this is a toadstool appearance with flattening and elongation of the articulating surface. So this is flattening and the articulating surface is elongated, and also there is a posterior inclination of the condyle. So all these radiological features give the diagnosis of a disease, that is a TMJ disease. It is known as a juvenile arthrosis, that is juvenile arthrosis, and this is the common name used for this TMJ disorder. So in this question the options given are osteoarthritis, Boring's arthrosis, psoriatic arthritis or septic arthritis. So this juvenile arthrosis is nothing but this Boring's arthrosis, and he is the person who gave the term juvenile arthrosis. And other names of this juvenile arthrosis includes condylosis or arthrosis deformans. So if any one of the option from these three things, you can pick that answer, but most commonly it was called as a juvenile arthrosis, but to give in a tricky way we have given that other synonym of this juvenile arthrosis. And here this juvenile arthrosis, it is nothing but a condylar growth disturbance, mostly occurs in the female. Mostly occurs in females, and maybe one etiological factor is hormonal imbalance. Okay, then if you go into this question, this is a statement based question. Here it is given as high linear energy transfer radiations concentrate their ionization along the longer path, whereas second statement is given as the greater the physical size of the particle, higher its charge and lower its velocity, and greater is its LET. So what is this LET? LET is nothing but a linear energy transfer. You can see here the name indicates transfer is nothing but a rate of loss of energy. So this rate of loss of energy is called as a linear energy transfer. In first statement, this option of this question is D, that is the first statement is false whereas second statement is true. So if you go into the first statement, it has given high linear energy transfer radiations will do along the longer path, but it is wrong. This high linear energy, if there is a high linear energy, they will rapidly produce ion pairs so that they will concentrate their ionization along a shorter path. That is, if they have a high linear energy transfer, they will rapidly produce the ion pairs and they will concentrate their ionization only along the shorter path. That is, that energy is lost frequently or completely within a short period of time. But if there is a low linear energy transfer, these ion pairs are produced sparsely, that means slowly, hence that ionization will go along a longer path. So hence the first statement is false. If you go into the second statement, greater the physical size of the particle, yes, if the size is large, then charge is also large, but as it is a heavy atom or a molecule, it cannot move fastly, hence the velocity is low. So this statement is correct, and this all are related to greater LET. So LET is directly proportional to size and charge, whereas inversely proportional to velocity. So a particle with a large size have a high charge, with low velocity will have a greater LET. So molecules are a particles with high LET, I mean large size is alpha particles, that is they have LET greater, whereas low LET is for beta particles. So here the question given is hypoxic conditions are whether they are radiosensitive, whether they are radioresistant or not to be considered. Here the option can be chosen is they are more radioresistant. Why? Because see, in generally the radiation will induce ionization. So this ionization will cause free radical production, which in turn leads to DNA damage. So for this DNA damage, oxygen is required. How? Because if oxygen is more electron affinic molecule, that means this oxygen will come and bind to the free radicals produced during ionization, and they cause permanent damage of DNA. But if oxygen is absent, then the DNA is repaired back. Hence the condition becomes radioresistant. That means cells cannot be killed. Hence hypoxic conditions are more radioresistant. When you go into this question, no X-rays are generated. You can see in this diagram, and this no X-rays are generated during inverse voltage. So this during this inverse voltage, that is during each cycle, there will be a half of the cycle where filament will become positive and target becomes negative. That is opposite to the normal X-ray machine. So here the filament becomes positive and target becomes negative, and therefore no electrons passage from during this cycle. If no electrons pass, then there is no X-ray production. No X-ray production. So during inverse voltage, it is also called as a reverse bias. So during this there is no production of X-rays. So steps in analog to digital conversion. This is nothing but the process. This analog to digital conversion is a process for formation of digital image. So this analog to digital conversion will have two steps, that is sampling and quantization. Sampling, here the sampling is nothing but all the voltage values are grouped together. Values are grouped together. So it is a sampling, I mean grouping. Whereas quantization, all this sampled data, a value is assigned. Value is assigned during the quantization. So the two steps in the process of conversion of formation of a digital image, that is analog to digital conversion, is sampling and quantization. This is a artifact image. So the question was distortion of metal structures as a result of differential absorption. So it is cupping artifact. So this cupping artifact is due to beam hardening. Beam hardening. In beam hardening, lower energy photons are absorbed. So this beam hardening is a type of artifact where lower energy photons are absorbed, And again, this beam hardening is divided into two types of artifacts: cupping artifact, whereas extinction or a missing artifact. So this cupping artifact is due to distortion of the metal structures as a result of differential absorption, whereas this extinction or a missing artifact is because of streaks or a dark lines are formed when the object is present between two dense objects. So dark lines and streaks are formed when present between two dense objects. It is the extinction or missing artifact. These can be seen in CBCT. So coronal CT imaging shows trapdoor appearance. This is a easy or a direct question. Here this is a coronal CT. Here you can see in the orbital floor fractures that the muscle is trapped between the fracture line. Hence it appears as a trapdoor appearance, and it is a feature you can see in the orbital wall or a blowout fracture. So transducer in an ultrasound machine acts as. So this is the line diagram, internal structure of the transducer. The main component of the transducer is nothing but a probe which is used during the USG, that is ultrasonographic examination. So this transducer consists of piezoelectric crystals or elements which are mainly useful for the transmission and receiving of echoes. And these piezoelectric elements are mainly made up of quartz. Then here because of this piezoelectric crystals, it can transmit the sound and it can receive the sound. So hence the transducer in ultrasound machine acts as both transmitter and receiver. And here you can see the pictures of transducers, various transducers. This is a curvilinear transducer. It works at 3 to 5 megahertz, whereas this is a linear probe. It works at 7 to 5 megahertz. It is a transvaginal probe or a transducer used at 6 to 5 megahertz. This is a small curvilinear transducer used at 5 megahertz. And in our extraoral imaging, we'll mainly use this linear transducer. This question is type of diagnosis and pathology based. You can see here a middle-aged person complaint of pain in the mandible. Revealed several small, regular, distinct radiolucent lesions, and Burns-Jones protein test is positive. So the most probable diagnosis is. So this pain in the mandible is of a clinical feature. Radiolucent lesions is of a radiographic feature, and Burns-Jones protein test is positive is of a pathology test feature. So if you interlink all these three things, these are combined and can be seen in a person who is suffering with a multiple myeloma. Even a eosinophilic granuloma or a metastatic carcinoma will have a radiolucent lesions, distinct radiolucent lesions, and patients will have a pain. But you can relate with this pathology test where a Burns-Jones protein test is positive. So you can directly select the option multiple myeloma. So an increase in the pericoronal radiolucency associated with unerupted maxillary canine is the diagnostic of. So if you go into the options given are AOT, complex odontome and compound odontome. This you have to see that question was presented with a pericoronal radiolucency. Even in complex and compound odontomes, there will be impaction of the teeth, or that odontomes will hinder the development of the teeth, but they will not present as a pericoronal radiolucency. Only this, among these options, AOT is present as a pericoronal radiolucency, and the one more option hint given is unerupted maxillary canine. So it mostly occurs in 2/3 of cases. It occurs in a associated with unerupted maxillary canine. So you can directly select the answer AOT. And here the list of pericoronal radiolucencies, that is pericoronal or a follicular space, dentigerous cyst, unicystic or mural amyloblastoma, adenomatoid odontogenic tumor, ameloblastoma, calcifying odontogenic tumor or cyst, ameloblastic fibroma. These are the list of pericoronal radiolucences. Periapical cemental dysplasia occurs at apical areas of non-vital teeth or apical areas of central incisors, tend to enlarge symmetrically, always surrounded by a well corticated margin. If you go into the periapical cemental dysplasia, into it mostly, it always present at the apex of vital incisors and mostly seen in female patients, that is middle aged. So this non-vital option is not there, and here the vital central incisors you can see, and here in the last option they gave that always surrounded by a well corticated margin. But if you go into the radiographic features, there are of 3 stages. First one is early stage, second one is mixed stage, third one is last stage, which is maturation stage. So in the first early stage, the radiographic appearance is lucent in the apical region, where in the mixed stage, a radio opacity is present in the center of the radiolucent area. When you go into the maturation age, the complete radio opacity can be seen at the apical regions. So if you go into this is wrong, and this is not, and they will not enlarge symmetrically. So the option can be taken as apical areas of the vital central incisors. So most common thing are incisors here. Which radiographic view best displays the buccolingual displacement of a mandibular fracture? If you go into this thing, the question itself says that buccolingual. So buccolingual thing can be seen mostly on occlusal radiographs only. So in periapical view and PA view, we will see whether a anterior posterior or a inferior and superior position, but buccolingual position cannot be seen in this periapical view and PA mandible. So the 2 options left are topographic view of the mandible, true occlusal. Both are occlusal only. So topographic is nothing but a anterior view, that is canine to canine, whereas true occlusal is a cross-sectional view. So cross-sectional view is also called as a true occlusal view. So in this cross-sectional view, we can see the buccolingual displacement very clearly. So to select the option is true occlusal view of mandible. Which of the statements is incorrect? You have to read properly, that is incorrect regarding the fractures. So this is regarding the radiographic features of the fractures. So there are 4 type of features. The first one is the fracture may present as a radiolucent line, or it can be present as a change in occlusal plane, or it can be seen as a step type defect, and the last one is it may be present as a radio opaque because of the overlapping of 2 fragments. So these are the 4 features of fractures can be seen radiographically. So you can seen as a radiolucent line between the fragments. Yes, radiolucent line is correct. Or seen as a radio opaque area in overriding fractures. Yes, during overlapping the present is radio opaque. And seen like a step deformity. Yes, but inferior dental canal is continuous in all types of fractures of the mandible. Maybe in very complex fractures it is discontinuous. Hence the option C is incorrect regarding the fractures. A dental cyst in maxillary antrum appears as, and here by seeing the cyst you will be select like a radiolucent lesion, but you have to know that is in antrum. In antrum it appears as a radio opaque thing. Radio opaque appearance can be seen for a dental cyst in the antrum. This is, and even the internal structure of the cyst is homogeneous, radio opaque when relative to the air sinuses. And even sometimes you can see a multilocular appearance, and within that multilocular appearance you can see sometimes a dystrophic calcification. And the radio opacity sometimes may mimic the bone because extreme contrast to the radiolucent area within the sinus. You have to note that radio opacity sometimes mimic the bone because extreme contrast to the radiolucent air within the sinus. So the option to be selected is opacity of the affected antrum. Here this is a clinical scenario which is of all radiographic and this thing clinical. A 60-year-old male reported with a chief complaint of bad breath, mobile teeth since 2 months. On further questioning about medical history, patient revealed pain in bones since 2 to 3 months. Pain was dull in nature, localized, intermittent, aggravated on movement and relieved on taking medication. Intraoral examination revealed chronic generalized gingivitis, mobility in relation to 3-1, 3-2, 4-1 and 4-2. The patient was subjected for radiographic investigation, PA skull and lateral skull, which revealed multiple punched out radiolucences. If you go into the previous question, a question was given with a 2 lines, that is with a pathological combination, radiographic combination and a clinical. But that is a direct question where you can choose the option multiple myeloma. See, you can see the difference between the 2 questions. Here also bad breath, mobile teeth and pain in the jaws or bones with generalized gingivitis or the movement of the teeth, and the radiographic features revealed multiple punched out radiolucences. So all these features of a multiple myeloma, but in the options they have given as associated with proliferation. So this is regarding into the pathology, that is multiple myeloma is because of the proliferation of plasma cells. So you have to interlink here like radiology, pathology, medicine and even the general pathology. So this option can be selected as plasma cells. Xylographic appearance of the parotid gland in Sjogren syndrome is described as cherry blossom like, because here this is a cherry blossom like appearance, and the Sjogren syndrome you can see weakening of the epithelium. So this weakening of the epithelium will allows all the contrast medium outside. So there is pooling of contrast medium outside the duct or outside the gland. So here there will be a formation of punctate cavitatory defects, and this is given in the textbook, which is a direct line. And this before the development of this punctate cavitatory defects, there are few pooling of this contrast agent can be grouped into punctate, which is less than 1 mm, globular, which is 1 to 2 mm, and other thing is as the disease progress this will be of irregular and there will be of cavitary, they will be greater than 2 mm. So these are the stages, almost the stages of xylography, how the contrast agent is pooled outside. They are called as xylectasis. So in punctate xylectasis, it is less than 1 mm, the contrast agent can be seen, whereas in globular it is 1 to 2 mm, cavitary it is greater than 2 mm. So it is because of punctate cavitatory defects in the ducts. Characteristic features of odontogenic myxoma. Here it is also a combination of pathology and radiology, and in options all the things, 2 things can be given as like pathology. Tendency of local invasion, you can see in this question all the features except tendency of metastasis, asymptomatic jaw expansion, multilocular honeycomb. So it will have a local invasion, but distant metastasis is not present as it is not a malignant one. And there is a asymptomatic jaw expansion, and even you can see a multilocular or a honeycomb appearance in odontogenic myxoma. In vascular lesions, magnetic resonance angiography is helpful in identifying. You can see it is a fusion imaging where MRI plus angiography is taken. So with the help of MRI, you can see the size of the lesion and extension of the lesion, whereas vessels involved can be seen with the help of angiography. Hence, with MR angiography or magnetic resonance angiography, you can see the size of the lesion, extent of the lesion and vessels involved. An inflammatory cyst occurring on the lateral aspect of the third molar with an associated history of pericoronitis. You have to note here the important thing is with the history of pericoronitis, and all the other two things, I mean ameloblastoma and sometimes OKC is also associated with unerupted teeth. But for pericoronitis, there is a cyst called as paradental cyst. You can see here, it is an inflammatory cyst occurs on the lateral aspect of the third molar with an history of pericoronitis. So, as pericoronitis present mostly seen in the younger age group and associated third molar on buccal surface, or even it covers the bifurcation also. If you go into the radiographic features, it has a well demarcated radiolucency distal to the partially erupted tooth. These are the important points to be noted for the paradental cyst. But you have more important thing is there will be of intact periodontal space. It reveals that the lesion is not originated from the apex. So this is a lengthy question, but this is a statement like thing. If teeth are in the radiation field and dose is greater than 5000 rats, periodontally involved teeth and teeth with periapical lucency should be extracted. So here the direct single thing is, he is asking when the teeth to be extracted before the radiotherapy. It is nothing but we have to extract the teeth 2 weeks before the radiation therapy begins, if we are using a 5000 rats. And even for the conservation purpose or a prophylactic purpose, and to prevent the post radiation, we can use a customized fluoride trace with a 0.4% stannous fluoride. It will prevent the radiation caries, and the patient has to be called for a period of 2 to 3 month recall after the radiation therapy. When evaluating the intraoral periapical films, which structure have a improved sharpness? So this is also a statement, direct statement. The improved sharpness will be seen for the lingual surfaces on a periapical films. This question is from dosimetry. So dose equivalent is expressed in the terms of, dose equivalent is nothing but a equivalent dose which will give the biological effectiveness of radiation. So it is measured in the terms of sievert. Sievert is a SI unit, traditionally is a rem. When you go into the conversion, 1 sievert is equal to 100 rems, and this whole box is important for the dosimetry, and they can ask the definitions, they can ask the units, traditional units, or a conversion of the units. Which of the following focuses the electrons into a narrow beam and directs the beam across the tube towards the tungsten target of the anode? So this is the tungsten target of the anode, and this is the molybdenum cup, and this is a filament. So here they asked which of the following focuses the electrons. So this molybdenum cup will focus the electrons towards the tungsten anode, whereas the filament will release the electrons. So you have to read the question carefully. Focuses is cup focuses the electrons towards the anode, whereas the filament will release the electrons. Reverse basilar view is to demonstrate, and it is a direct question which is given, direct line which is given in the textbook, and this reverse basilar view is mainly used for examination of deep parotid gland. A method of obtaining a digital image where sensor captures the image and immediately transfers it to a computer is termed as direct digital imaging. So here you may be confused with indirect or a direct digital imaging. So here this is a method. A digital image is sensor will capture the image directly. So that sensor, as sensor is capturing the image directly, it is a direct digital imaging. What happens in indirect digital imaging? That digital image which is present already is converted with the help of CCD. Hence, this is the indirect digital imaging. And storage phosphor will use the PSP plates. So here our sensor is directly capturing the image. It is direct digital imaging. This is also a direct definition. Hot filament of a tungsten emit electrons at a rate proportional to the temperature of filament. This process is called as a thermoionic emission. These are the color codings for RIN XCP holders. For bite wing, we will use red. The question was given for bite wing. For bite wing, it is red. For anterior, it is blue color. For posterior, it is yellow. A specialized radiographic technique, which is an electrostatic process similar to that of used for xeroxing. So in this question, the direct technique was not given. Here the definition was given, that is an electrostatic process similar to that of xeroxing. It is nothing but a zero radiography, and this zero radiography has advantages, that is it has high contrast. The image will have high latitude. It will have good detail and high enhancement. So the correct option is good detail. And this zero radiography used for the lateral self TMJ problems mostly. Which of the following do not have a sun-ray appearance? So sun-ray appearance you can see in osteogenic sarcoma, neuroblastoma and chondrosarcoma. But osteolytic sarcoma, you cannot see a sun-ray appearance. It is mostly you can see of lytic, so you can see of mostly distraction. While taking IOPA radiographs of the maxillary first molar, to avoid superimposition of zygomatic arch, the X-ray tube should be angulated. So this is the modification for the normal technique. Here we'll place the cone mesial and this vertical angulation should be decreased, and we have to place more mesially such that this zygomatic arch will not superimpose over the maxillary first molar. If you see in normal radiograph, the apices of molars will have sometimes zygomatic arch, but if you place the cone mesial with decrease in vertical angulation, that superimposition can be avoided. L and T dose relationship gives a direct relation between, and this is also a direct question where you can see that L and T relationship give the radiation and cancer genesis. L and T is nothing but a linear non-threshold hypothesis. Linear non-threshold hypothesis. This will give the relationship between the dose and risk of inducing a new cancer. Which of the structures hinders in the imaging of roots of maxillary molars? That is zygoma and zygomatic process of maxilla. In this you can see the zygomatic process of maxilla which hinders with the roots of maxillary molars, and here you can see the inferior border of the zygoma also, and this thing also zygomatic process of maxilla. So for the maxillary molars, zygoma and zygomatic process will hinder the apices. What is the role of potassium bromide and benzotriazole in the developer? They both act as a restrainer. Restrainer means it prevents developer from developing unexposed silver halide crystals. So this is the definition of restrainer, which is potassium bromide and benzotriazole which are present in the developer. Which are advantages of bisecting technique? Increased accuracy, simplicity and short exposure time. Here the simplicity of the technique and short exposure time are the only two things which are the advantages of bisecting technique. There is no increased accuracy, instead there is a distortion, because in bisecting angle technique we will use a short PID. So we have to select the options of 2 and 3, that is C. An instrument that is used to help the dental radiographer for stabilizing receptor in the mouth. So for stabilizing the receptor in the mouth, the instrument used is receptor holder. Then what is beam alignment device? Beam alignment device used to position PID in relation to tooth and receptor. That is here that helps to position indicating device in relation to tooth and receptor. Whereas collimating device, as think you people know, it is used to further restrict the size of X-ray beam. X-ray beam size. So the option is receptor holder. Apex of maxillary sinus is formed by. This apex is formed by zygomatic process of maxilla, whereas here you can see the floor of the orbit forms the roof of the maxillary sinus. It forms the roof where it forms the apex. A radiograph of a mandibular anterior teeth in patient reveals radiolucency at the apices of right and lateral central incisor. No resorptions and cavities are present. There is no pain. Pulps are white. And here the answer lies everything in this single sentence. Even though that is a very lengthy question, the pulps are vital. If you go into the options, periapical granuloma, radicular cyst, chronic abscess, here pulps are non-vital. Whereas the remaining option, only thing is cementoblastoma, where the pulps are vital, and this cementoblastoma mostly named as a true cementoma. It is also called as a true cementoma. So with this thing that pulps are vital, you can select the option as a true cementoma or a cementoblastoma. At what kVp K-shell electrons are emitted? This is a direct question. At 70 kVp, the K-shell electrons are emitted. Bisecting angle technique. This is also a direct question. This bisecting angle technique is based on a principle called as rule of isometry. It is also called as Shizinski's rule, where it states that if two triangles are equal when they share one complete side, they have two equal angles. So this is the rule of isometry. When two triangles are equal, they share one complete size, then they have a two equal angles. So this is a rule of isometry or Shizinski's rule, where bisecting angle technique is based on. Ghost image and OPG occurs when there is a image of dense object within the path of a beam but out of the focal trough. So the ghost image forms when out of the focal trough but the path of with the object is within the path of the beam. There are other characteristics for the ghost image. First is it has the same shape when related with the counterpart. That is, when related with the real image, it will have a same shape. Then it appears opposite side of the real image. It appears higher when compared with the real image, more blurred when compared with the real image. Vertical, actually there are two components of the image, vertical and horizontal component, but vertical component is more blurred and always larger. Here what? Always larger. So more blurred than the horizontal component and always larger than compared with the counterpart vertical component. A gentle depression in the maxilla near the apex of lateral incisor is referred to as lateral fossa, but even the lateral fossa is also called as a incisive fossa, hence the option would be selected as D. So in this picture you can see the lateral fossa which appear as a diffuse radiolucency in the region of apex of lateral incisor and formed by it is because of the depression of maxilla. Radiograph is of no use in the diagnosis of. You can easily select you have to remember that in acute cases mostly there are no radiographic findings. To see the radiographic finding, that there should be that lesion should be turned into a chronic, or at least 30% to 40% of demineralization should take place. So in this thing, acute abscess do not show any radiographic findings. So there is no use of taking radiograph is a no use in diagnosis of acute abscess. X-rays cause radiation damage primarily by their property called as ionization. So the process of forming a ion pair is called as ionization. So because of this ionization effect only, there will be DNA damage. Here it is an application question. A patient with a unilateral parotid swelling shows clinical presentation of swelling, redness, tenderness and malaise. So you have to note that tenderness, redness, malaise, everything will come under prodromal symptoms. So these prodromal symptoms mainly we will see for the acute cases. And enlarged regional lymph nodes. Which of the following radiograph is not advised? So if some people may have selected parotid swelling, they have selected salivary, but salivary I mean other thing, because salivary is not advised here, because by reading the question you can see that patient in an acute stage. So the contraindication of salivographic procedure is in acute infection or inflammation. You should not select salivography because it may damage the parenchyma of the gland. You can do multi-detector CT, or you can do USG, or you can do MRI in acute conditions, but you should not do the salivography. It is a contraindication for salivographic procedure. For a bite wing X-ray angulation, the cone should be 10 degrees above horizontal. Why? Because to prevent the overlapping, we will make 10 degrees above horizontal. The pools of contrast agent in salivography of autoimmune disorder which are irregular in shape. So we have seen earlier that there are three states like punctate, globular and cavitary. That cavitary salactasis will have a greater than 2 mm. Dimensions will be of greater than 2 mm contrast agent. So the option is D. This is a clinical scenario based question. A patient with a previous history of sarcoidosis complains of pain in the lower right back tooth region. On examination, you have seen root stems in the region of 48, 38, 18, 28 and 25. So as many teeth are involved and they are very like root stems, you'll advise the patient to go for the OPG. So on OPG, you have seen calcifications with near the ramus and cauliflower like appearance, and these are type of which calcifications, and you have to note that sarcoidosis, previous history. Sarcoidosis is a granulomatous, chronic granulomatous disorder, and so this calcifications are of soft tissue calcifications which are present behind the ramus, and they are like cauliflower like appearance. Cauliflower like appearance, and behind the ramus is the position for the lymph nodes. So that lymph nodes are calcified, and incidentally you have seen that lymph node calcifications in OPG. So what are the lymph node calcifications are a type of dystrophic calcification. So this is indirect. So you have to know what is a type of soft tissue calcification and how the and which it comes under which classification. So it is a lymph node is a dystrophic calcification. These are the list of soft tissue calcifications. They may be a dystrophic, idiopathic, or a metastatic. Dystrophic may be calcified lymph nodes or calcifications near the tonsils, cysticercosis, arterial calcification, or Monkerberg's medial calcinosis, or a calcified atherosclerotic plaque. When you go into the idiopathic calcification, our common xylolith is idiopathic, phlebolith, laryngeal cartilage calcifications, rhinolith or anthrolith, these come under idiopathic calcifications. When you go into the metastatic, ossification of the styloid ligament and osteoma cutis or myositis ossificans, these are of metastatic calcifications. Which image plane passes from bottom of the eye socket? This is eye socket to the top of the ear. This is nothing from outer canthus to the tragus, or a outline of the top superior most portion of the ear is nothing but a Frankfurt or horizontal plane. Which projection is best for the examination of condyle and articular eminence? So transcranial view is best example for the examination of condyle and articular eminence. So in transcranial view, we can see lateral aspect of the glenoid fossa, articular eminence, joint space, and condylar head. These are the list of radiographs which are used for the TMJ, and in each view a different structures of TMJ can be examined. So this is very important and you can note down this. Most sensitive phase in the cell division to radiation is. So if you go into the order of sensitivity, M phase is more sensitive when compared with the G2 phase, then G1 phase, then early S phase is more radiosensitive, then late S phase. So this is the order of sensitivity from more to least radiosensitive. So option more sensitive in this is G2 phase. An area of high attenuation, in this question itself it shows high attenuation because of high dense objects. So the options present in this are metal crown, bridge, and amalgam restoration are more dense and they have more high attenuation when compared with the normal bone, and it will stop the radiation from reaching the receptor. So option you can select is all the above. Which restorative materials appear equally radio-opaque? This is a direct line, that is equally radio-opaque will be of gold crowns and amalgam will be of equally radio-opaque on a OPG. Which statement describes the relationship of the receptor means film to maxillary and mandibular teeth? So in bite wing technique, the film and to the maxillary and mandibular teeth, they are parallel to each other. That is, the film is placed here and the tooth will be of like this. So they both are parallel to each other. So we have to select the first option. The receptor and the teeth are parallel to each other. Incorrect horizontal angulation results in images that are overlapped. So for horizontal angulation there is only one fault. If the horizontal angulation is incorrect, then the teeth will be of overlapped or the structures will be overlapped. You will get elongated images if the vertical angulation is too short, and you will get foreshortened if it is too much vertical angulation, and for horizontal it is overlapped. Following anatomical structures can be visualized in an IOPA except, you can see here, you can see the internal oblique ridge, you can see the submandibular fossa and even incisive foramen, but mandibular foramen cannot be seen and it can be viewed in the 3D picture or a CBCT. The purpose of lead foil sheet in the film packet is. So you have to know where the lead foil sheet is present. So if you take the internal structure or layers, first you will see the lead foil on the back side. That means back side, that is away from the cone. This is because away from cone, and this placement of lead foil away from the cone or backside will protect the film from back scattered radiation. The film characteristic, that is amount of radiation needed to produce the radiograph with standard density. So this is the direct definition for the stand speed, that is amount of radiation needed to produce the radiograph of a standard density. Increasing the exposure time will, so this exposure will cause more number of photon energy, or more number of energy of photons increased. It causes increase the density of the film, and if density of the film increases the darkness of the film. So exposure is high, then density is high, and image appears darker. And this is a little bit application question. X-ray beam A is produced using 70 kVp, 7 mA and 0.1 S. And X-ray beam B is produced using 70 kVp, and there is an increased mA, and even there is an increased in time, that is MAS is increased for beam B. So which of the following statements are correct? The option should be chosen as beam B has a higher number of X-rays. So if you go into the first option, beam A has higher mean energy. No, because beam B has higher mean energy. No, because energy is directly related to kVp. If you go into A and B, both have 70 kVp. So they have equal energy. So both statements are correct. And the maximum energy of X-ray photons is higher for beam B. No, energy is we have told 70 kV for both, so no. But beam B has higher number of X-ray photons. Yes, because MAS is the quantity of photons, that is number of photons released. So for in beam B, MAS, the number of photons are more. Hence the option should be chosen as beam B has higher number of X-ray photons. Which of the primary reason to use ultrasonography as imaging technique? And all the options given are uses of USG, but the prime reason using for the USG is to differentiate solid masses from the cystic lesions. And if you to map the ducts of the salivary glands, silography will use for the seeing the ducts. And to these space infections, mostly they are not indicated, but you can see. And to determine the anatomic location and adjacent salivary glands, we will not use this USG mostly. So the most selected thing for USG, or the primary reason, is to differentiate solid masses from the cystic masses. And this is a scenario. A patient complains of swelling associated with decayed upper left molar. Patient also complains, you see here, decayed upper left molar, and also complains of stuffiness, especially when she bends over to pick anything. So here you have to note that in sinusitis cases, the patients may complain of toothache, and also along with the toothache, the patients will have a tenderness or a stuffiness or fullness when we ask the patient to bend his head. So to better option to choose in this question is what is they have given evaluation of maxillary sinus area. So for the evaluation of maxillary sinus area, the best option to choose is Waters projection. Which term describes two or more atoms that are joined by chemical bonds? So the term describes two or more atoms that joined by chemical bond is a molecule. Whereas if atom that gains or loses an electron and becomes electrically unbalanced is known as an ion. And when an electron is removed from an atom in the ionization process, an ion pair is formed. And a proton carry the positive electrical charges. So the molecule is describes two or more atoms that are joined by chemical bonds. A patient is provisionally diagnosed with submesenteric infection. to see for the presence of mediolateral expansion of the lesion, which conventional extraoral view is advised. So here this PA rotated view is used for two purposes, that is for the examination of parotid gland, and one more thing for seeing these submesenteric infections, and also for the mesiolateral expansion of the lesion. So the option is PA rotated view. Which statement is incorrect? So here the statements given all are correct regarding the properties of X-rays. So the option should be chosen as none of the above. And in this box I have given all the properties regarding the X-rays. So you have to know all these things. They can be asked in a statement type of questions. Increasing which of these four exposure parameters will increase the intensity of the beam? And you have to see that intensity is directly proportional to kVp, milliamperage and time, but it is inversely proportional to source to receptor distance. That is nothing but a inverse square law. This is inverse square law. So here the only these three things, that is kilovoltage, milliamperage and exposure time, 3 will choose the will increase the intensity of the X-ray beam, whereas source to receptor distance is inversely proportional to the intensity of the X-ray beam. If the half value layer is 3 mm, with what thickness of aluminium is necessary to decrease the intensity by half? I think few people have selected option 1.5, but you have to note that half value layer is nothing but the thickness of aluminium. So here the aluminium thickness is 3 mm. So 3 mm is needed to decrease the intensity by half, not the half of aluminium layer required. So the half value layer is thickness of aluminium. Here thickness is given is 3 mm. So this 3 mm is needed to decrease the intensity of the beam by half. So option is 3 mm. Which statement is correct? In this statement, you have to know there are of two types of effects, short term and long term effects. Short term means more radiation in short period of time, whereas long term effects means less radiation in long periods of time. So if you see these two things, the correct option will be of long term effects with small amount of radiation absorbed in long period. So option D is correct thing. Arrange the annual sources of radiation exposure from smallest to largest. So if you go for the cosmic thing, cosmic space, here that is 11%. For radon or thoron it is 73%. For terrestrial soil it is 7%. For internal nucleoids it is 9%. So the options can be chosen is C, that is 3, 4, 1 and 2. So C. Which statement is true for a radiation monitoring badge? And the radiation monitoring badge should not be worn by a radiographer when he is going for exposure. That means when he want to expose himself, he should not use the radiograph badge. And this radiograph badge cannot be shared between other employees. And it should be worn, as this radiation monitoring badge should be worn at a waist level when exposing the X-ray receptor. So the option C is true for this radiation monitoring badge. Which term describes the dose of radiation that the body can endure with little or no chance of injury? So this is maximum permissible dose. That means it can endure with little or no chance of injury. And this occupationally exposed dose is nothing but it should not exceed an accumulated lifetime radiation dose. And if you go into the Alara principle, it states that all exposure to radiation must be kept as minimum as possible. Which position indicating device is most effective in reducing patient exposure? That is nothing but a rectangular one. Rectangular one will reduce the patient exposure by 60% when compared with a circular collimator or a circular PID. A radiographer that exhibits areas of black and white is termed as high contrast and is said to have a short contrast scale. A radiograph that exhibits many shades of grey is termed as low contrast and said to have a long contrast scale. To limit, so this is one statement. To limit the image magnification, the longest target receptor distance and shortest object receptor distance is used. So if you go into the first statement, it is confusing. So you have to remember that long scale will have low contrast. That is, you can remember that is L and L. So long scale thing will have low contrast. You can remember L and L. Whereas short scale will have high contrast. Long scale means many shades of grey. Short scale means few scales of grey. So the first option is correct. To limit the image magnification, so to prevent the maximum magnification, that means target receptor, that is anode to the film distance should be more, whereas object and receptor film distance should be decreased. From list below, order the following from least to most radio opaque. I mean, from in this the least radio opaque will be of maxillary sinus. Then it will be of bone. Then it is of dentine. Then it will be of enamel. Then is of amalgam. So the option 42351. Most susceptible to radiation are these muscle cells and nerve cells. They are of radio resistant, whereas less radio sensitive, whereas epithelial cells are radio sensitive and nucleic acid sensitive. But among all those things, the nucleic acids are more susceptible to radiations. A patient requires tooth extraction from an area that has been subject to radiation therapy. Which of the following represents the greatest danger? So for this question, you have to remember, any patient has a history of radiation therapy, you should not do the extractions for a period of 6 months after therapy, because it may end up with the osteoradionecrosis. And these are also statement questions. The pattern of stored energy on an exposed film is termed as a latent image. This image remains invisible until it undergoes processing. So you all know that stored energy will form as a latent image, and this latent image is developed into the diagnostic image after it undergoes processing. Then the second statement is the function of developer is to chemically reduce exposed silver halide crystals to black metallic silver. Yes, if you go during processing, before going into processing, this is before processing thing, and if you place into the developer this normal silver halide crystals, they are converted into metallic grains. Your assistant has processed 3 panoramic films today. She noticed that films are progressively getting lighter and lighter. What should be done to correct the problem? And if you go into the textbook statement, that they will become lighter and lighter because that concentration of the developer is decreased. So you have to add the replenisher daily. That replenisher is nothing but 8 ounces of fresh developing solution, and this replenisher is mainly used for 5 panoramic films development. So option is replenish the developer first. In dental X-ray tube, number of electrons flowing per second. In the previous questions, you have seen that number or a quantity is nothing but milliamperage. So number of electrons flowing per second is measured by milliamperage. Which of the following supplies electrons necessary to generate X-rays? So cathode will supply the electrons. That means cathode has 2 things, right? tungsten filament. This will supply the electron. So the cathode is negative. So the option will be of negative cathode. This is tungsten filament. Rectification is the conversion of direct current DC to an AC, and the dental X-ray tube acts as a self-rectifier that changes DC to AC while producing X-rays. No, the both options are wrong, because this rectification will convert AC to DC, and even the dental X-ray tube will act as a self-rectifier that will changes AC to DC. But if you go into the above statements, they have given us DC to AC. Hence, the both statements are false. So, this is the correct thing. The occlusal image may be used for evaluation of periodontal disease. The bisecting technique is the preferred periapical exposure method for the documentation of periodontal diseases. Yes, if you go into the first statement, yes, occlusal images may be used, because you can see the buccolingual, and sometimes in the topographic views you can see the tooth structure, I mean along with the alveolar bone. But if you go into the second statement, this bisecting technique is preferred. No, the bisecting technique is not preferred for the documentation of periodontal diseases, because you can see the image distortion in bisecting angle technique. So hence we will use paralleling angle technique. When compared with the bisecting angle technique, it is for the periodontal disease evaluation. So the first statement is true, whereas the second statement is false. This is a clinical, all the clinical features combined with the radiographic findings. It is of a syndrome. A patient on an examination has downward inclination of palpebral fissures, malformation of the external ears, absence of the external auditory canal. So these all are the clinical features where you can see on the patient. So you have then you have went for and you have given a provisional diagnosis of one common type of mandibulofacial dysostosis as a provisional clinical diagnosis. Then you will ask for the patient to go for the radiographs, and in the radiographs you will find a finding which are more characteristic or a striking feature of this syndrome. So you have to see that downward inclination, malformation of external ears, and absence of external auditory canal is the clinical feature of a Treacher-Collins syndrome, and it is the most common type of mandibulofacial orthosis. So Treacher-Collins syndrome. So in Treacher-Collins syndrome, if you advise the radiograph, the most striking feature is zygoma bone hypoplasia. That means in these patients there are hypoplastic zygomas. See here, you can see zygoma hypoplasia. And here external auditory meatus. This is the picture of Treacher-Collins syndrome. So these type of features can be seen in Treacher-Collins syndrome. A patient on clinical examination show brachycephaly, hypertelorism, and orbital proptosis. So you have to link these clinical features one syndrome. So these all clinical features are related to syndrome called as Clausen syndrome, because orbital proptosis or protruding eyes is a characteristic feature of Clausen syndrome. And what will you see in Clausen syndrome on radiographs? That is suture synostosis. So you have to interlink the clinical features with the radiographic diagnosis, and then you have to find out the answer. A patient reported to the department with a chief complaint of pain in the lower left quadrant. On clinical examination, 3-5 has deep dental caries and tender on percussion. On radiographic investigation, 3-5 has a radiolucent lesion in the periapical region, and incidental finding was seen in relation to 3-6. So all this question was lengthy to add up a time for you, but the answer lies in the last two lines. And that is, incidental finding is seen in relation to 3-6, where 3-6 has a elongated pulp chamber and more apically positioned furcation. So elongated pulp chamber or a apically positioned furcation is seen in the developmental anomaly called as taurodontism, which is seen as an incidental finding. So this taurodontism is a feature of Which syndrome? This is frequently associated with the trisomy 21. So you have to interlink the clinical features with radiographic features of the dental anomaly. The radiographic feature of a circular or oval radio-opaque area with central radiolucency representing a apical foramen and root canal occurs most often in. So this radiographic feature is for dilaceration. So if there is a dilaceration on radiograph, you can see this type of radiographic appearance, and this type of radiographic appearance is called as bullseye. So this type of radiographic appearance seen in dilaceration, which dilaceration is most frequently occurs in maxillary premolars. A patient complains of discoloration of teeth. On examination, the color of the underlying dentin imparts yellowish brown color to tooth. In addition, you have to note this thing, or you have to see this line. It is important. Enamel appears to be rough, smooth or glossy. The crowns appear to be undersized or roughly square shape. The reduced enamel thickness also causes loss of contact between adjacent teeth. So in this question, all the clinical features of some developmental anomaly was given of teeth. So all these clinical features are related to the amelogenesis imperfecta, and in amelogenesis imperfecta, if you go into the hypoplastic type, the enamel thickness is reduced. If you go into the hypomaturation type, that enamel has a mottled appearance, and if you go into the hypocalcification, that crowns will be of a normal size and shape, and enamel is of regular thickness. So these all clinical features are related to hypoplastic type. And the hypoplastic type, the radiographic appearance will be of picket fence. So the option you have to choose is the picket fence hypoplastic. A patient of record has been a fight where he was punched just below the right eye. A zygomatic complex fracture is suspected. Which of the following external? So the patient has a zygomatic fracture. You have to select the radiograph, and otherwise you have to advise the patient a radiograph. Then what radiograph you will advise? Water projection is mainly for the maxillary sinus. Reverse tone projection, it is mainly for the condyle. Lateral cephalometric for the orthodontic purposes. And you can see the mandible deformity. But here they have asked zygomatic complex fracture, which may be clearly viewed on the submentor vertex projection. The most common oral problems that occur following the radiation and chemotherapy include mucositis, infection, pain and bleeding. Yes, because in radiation and chemotherapy, after that there will be of pancytopenia or decreased blood cells, which leads to the increased infection or pain and bleeding. The oral cavity is irradiated during the course of treating radiosensitive oral malignancies. Yes, because we will give radiation because of malignancies like squamous cell carcinoma. So here the both statements given here are true. Unopened boxes of radiographic film should not be stored in the dark room. So that radiographic films are never stored in the dark room. Why? Because we will get a chemical fumes from the processing solutions will fog the film, and even the continuous safe light exposure should not be recommended, because sometimes the box may be of a little open or a tear, or the box may have a tear that may expose the film. So these are the three things which shows that we should not share the radiographic film, should not be stored in the dark room. So option is of all the above. The hydroquinone in the developer brings out the dash tones, whereas Elon in the developer brings out the dash tones on a dental radiograph. So you have to remember this. Hydroquinone will bring out black and white tone, whereas Elon will bring out grey tone. So to choose the best option is the grey will be in the last option, and black and white, either a black or a white tone is given by the hydroquinone. So choose that best option is answer D. On average, processing solution should be replenished. That is, processing solution should be replenished on an average of once daily with 8 ounces of fresh developer. So coming to the pictures, see this picture shows the thin septa, and this is a characteristic feature of odontogenic myxoma, and this is the direct textbook picture given from the white and farrow. So you can go near the odontogenic myxoma and you can read the features. And here you can see these are the sagittal and coronal pictures of CT, and here there is a something deformity. You can see this thing, the density of the cortical, this is called as a cortex, the density of cortical bones increased. So the density of cortical bones is increased is seen in Paget's disease. So what is this? This is a tram appearance which can be seen in Monkerberg's arteriosclerosis. This is a type of soft tissue dystrophic calcification. This picture they have given for the OPG zones. So we have to interpret the OPG in a 6 zones. So if you go into the zones of OPG, this is zone 1, which includes all the teeth structures. All the teeth and the supporting teeth structures and the supporting bone. Whereas zone 2, it will include the nose and the sinuses. Zone 3, inferior border or the inferior of the mandible. Zone 4 is for the condyles bilaterally. Zone 5 is for the ramus region, whereas zone 6 is for the hyoid bone. So you have to remember this zones of OPG for interpretation. So what is this thing? This radiographic appearance is dens invaginatus. So you can see here the radio opacity of the tooth, which is inverted or invaginated into the tooth. So don't confuse with the internal resorption. This is for dens invaginatus, which is given in a textbook. And what are these calcifications? These are soft tissue calcifications, or which are named as a phleboliths, and these phleboliths are idiopathic soft tissue calcifications. So this is a type of root resorption. You can see that root resorption is spiked here. So spiked type of root resorptions mostly seen in malignancies. In this radiographic appearance, you can see the arrow mark, a radio opaque line is seen in the radiolucenity. So this type is called as snow-like appearance, and which is mostly seen in the CEOT. Snow-like or a snowstorm or a snowflake type of appearance in CEOT. So this is whether a T1 weighted image or a T2 weighted image. So you have to go into the differences T1 and T2. T1 will have a CSF dark and fat is bright. But if you go into the T2, the fat will be dark and CSF is white. So here all the fat present is dark. So, and even here it shows a pathologic anomaly, and pathologies are more commonly demarcated on T2 weighted images. Hence the given is T2 weighted image. Sausage string appearance in xylography is seen which of the following conditions? So this is a direct question. You have to remember that sausage string appearance can be seen in submandibular salivary gland with no obstruction. And this radiographic appearance, you have to note that it is near the canal, mandibular canal, and which is nothing but a neurofibroma. That is expansion of the canal. Expansion is seen. So it is neurofibroma. What is a type of artifact? This type of artifacts are called as aliasing artifacts or streaks, and which is seen in CBCT and mostly occurs because it is impossible for the scanner to take enough projections of the object, which is usually metal-like. If it is like a metal-like, it is for the scanner, it is impossible to take enough projections, and hence these appear like a dark lines which radiate away from the sharp corners, so which is called as a aliasing artifact or streaks artifacts. And this is a case scenario. I have told that 13 years female and lip swelling and everything. These are the radiographic features. And these radiographic pictures, you have to identify they are the pictures of USG, that is ultrasonography. And the lip swelling is there. And if you go into these two pictures, it is showing a color Doppler which is increased vascularity. So increased vascularity, and the options the given thing is one vascular lesion. So you have to select hemangioma. So first you have to find out which type of radiographic views are that. These are USGs, and this is USG with Doppler showing increased vascularity, which is nothing but a hemangioma of lower lip. A 73-year-old woman affected by multiple myeloma previously treated with bisphosphonates. You have to remember here multiple myeloma and bisphosphonates. Given radiographic images of the same female. So these are the radiographic images of that female. The possible diagnosis is. So if you go into the history of bisphosphonates, if the patients have a history of using bisphosphonates for a large period of time, that patients may develop osteonecrosis or a bisphosphonate induced osteomyelitis after some time. That is, if you extract the teeth, they'll have a complication of osteonecrosis or a osteomyelitis. So the patient is on bisphosphonates. And for this osteonecrosis or osteomyelitis, if we do the scintigrams or a scintigraphy, you can see that this is more observed, that radionuclide is more observed where there is a necrosis. So hence you can select as an option like osteonecrosis, because the patient have a more chances of developing osteonecrosis. So remember one thing, important point, patients who have used bisphosphonates will develop a osteomyelitis or osteonecrosis after a long period of time when there is a tooth extraction. OPG of a symptomatic adult discloses well-defined 1.5 centimeters radiolucency below the mandibular canal. The lesion is not palpable. Which of the following is most likely diagnosis? So that is not palpable and it is below the mandibular canal, and you can see that like it is a salivary gland inclusion defect, where mostly the salivary submandibular gland foci is seen. So you can select that as a salivary gland inclusion defect. On intraoral examination, patient reveals soft fluctuant tender swelling, anterior hard palate, vital anterior teeth, and a radiolucent area between the roots of maxillary central incisors. And this is a scenario, but the thing is you have to correlate with clinical features, and when you correlate with radiographic features, either cyst is present between the central incisors. The cyst which is present between the central incisors with a vital anterior teeth, you have to go for a nasopalatal cyst. Radiographic examination of left third molar region revealed a well-defined radiolucent area with missing third molar. Differential diagnosis include all of the following except. So you can think about ameloblastoma, residual cyst, odontogenic keratocyst, even in the absence of the teeth also. But when dentigerous cyst, it is should associated with a impacted tooth. Impacted tooth. Hence, maybe it is not a dentigerous cyst is not a differential diagnosis for a given scenario. Whereas these three lesions, you can, you can think of these lesions when there is an absence of tooth also. Rayleigh scatter is nothing but a scatter with a change in direction of photon without loss of energy. So in this scatter, there is a the direction of the photon is changed, but there is no loss of energy. These are the statement questions. They are given 3 statements. The first one is heat the cathode filament to generate electrons. Yes, we have to heat the cathode filament to generate electrons. Establish high voltage potential between anode and cathode, accelerate the electron. Yes, we have to establish the high voltage potential such that the electrons from the cathodes will accelerate towards the anode. And third statement is low voltage potential between cathode and anode. No, because this low voltage potential will not accelerate the electrons towards the anode. So hence it is wrong. So only the 1 and 2 options are correct. A somatic mutation produces poor health in the exposed individual but does not produce mutations in the subsequent generation. Yes, the somatic is nothing but it will produce only the exposed individual will have the effects. It is not carried to the second generations. But when you go into the genetic mutation, that exposed person will not be affected, but because of the mutations, it will affect the future generations. Hence, the both statements are correct in the given question. Dash establishes guidelines for the limitations of amount of radiation received by both occupationally exposed individuals and the public. So this is a NCRP and ICRP, that is National Council on Radiation Protection Measurements and International Council on Radiological Protection. They will induce the guidelines for the limitation of amount of radiation received by both occupationally exposed individuals and the public. You have to remember this NCRP and ICRP. Difference between rapid processing chemicals and conventional processing chemicals are only there is a one difference, because in rapid processing chemicals high hydroquinone concentration is seen and a high alkaline, because of that high alkaline and a high alkaline pH can be seen in a rapid processing chemicals. High contrast resolution of CT imaging aids in differentiating tissues whose difference in tissue densities is less than. So, in high contrast CT, you can differentiate the tissues. That means you can differentiate the densities which are less than 0.04. You have to note this. Even it can differentiate between the tissue densities of 0.04. Which property of X-ray is utilized in intensifying screen? In previously I have given few properties of X-rays. The physical property of X-ray is used for the utilized in the intensifying screen. So this given picture, you can see here, you will get a doubt whether it is a CT or a CT or MRI or something. You can see here this is a bony components which are seen clearly. So you have to remember, in CT bony components are seen clearly, but you can see the fat tissue also. So to enhance the fat tissue, a contrast agent is induced. So this X-ray is of CECT, that is contrast enhanced computed tomography. So it will enhance the fat, and because of CT even the bone can be seen clearly. So here that number 5, what is given? It is as a anterior nasal spine. What is this anatomical landmark? It is a mylohyoid ridge. What is this thing? This is a nutrient canal and this is a mandibular IOPA. The super concentrated solution that is added to the processing solution to compensate or the effects of oxidation is termed as replenisher. You have to remember that replenisher is a super concentrated solution. So this replenisher will prevent the oxidation. On the average, processing solution should be changed. So there you have to remember two statements here. Processing solution should be replenished daily, whereas they should be changed for a 3 to 4 weeks. Which describe the relationship of central ray to the receptor in paralleling technique. So in paralleling technique, what is the central ray relationship? If you take, this is a tooth and this is a receptor. So these are arranged parallel to each other, and the angle central ray is passed perpendicular or 90 degrees to each other. So here the 90 degrees to the receptor and also the long axis of the tooth. So option is B. The interaction of X-ray radiation with matter illustrated in the given figure demonstrate. So this is a figure given for a coherent scattering. In coherent scattering, there will be of scatter, but there is of no ionization. So option is C. So there is scatter is present, but ionization is absent. Then 27 number in the given picture is, you can see this is the given in question and this is all the labeled parts here. So the 27th one is a unleaded glass X-ray window. So you people go through all these labeled parts which are important, and they can ask any part like a image based question in the examination. The following threshold curve explains. So you should remember that deterministic effects are dose dependent, and all the threshold curves explain the deterministic effect, or dose dependency is always seen in deterministic effect. And in this picture, if you want to arrange from, as I have told, M is greater than, that is more radio sensitive than G2, G1, early S, late S. And if you go into this thing, these are the pictures given, and you have to match with the, you have to match with the this thing, options given in the question. If you go for this thing, first one, size 1 receptor. So this is a size 1 receptor, and this is a size 2 receptor. So this is a XCP aiming ring for posterior. You can see this thing, handle posterior. This is for anterior. See this anterior place thing. So here this is a indicator arm for posterior, and this is a indicator arm for anterior, and this is bite block for posterior, and this is white block for anterior. Remember the pictures, and you can easily remember with these handles. For anterior it is vertical, or anterior it is horizontal. Okay. Film holders given in the following image. So these are nothing but a snap ray holders. In the following figure, which exhibits high contrast? We have learned that long scale have low contrast, short scale have high contrast. But short scale means low shades of grey. So in which picture you have low shades of grey? B. So hence B has high contrast. The angulation in the given image, here the angulation is 60 degrees and this is a pediatric occlusal radiograph maxillary cross-sectional. The cause of error in the film, this cause is it is called as a reticulation of the film, and this reticulation of film is mostly due to sudden temperature change. And this is a light dense image, and this light dense image in the digital radiograph is mainly because of the noise. So hence it is a noisy image. The given picture is a lateral cephalogram arrow mark depicting the characteristic features of. If you see this arrow mark, the first here there is a enlargement of sella turcica, even the enlargement of frontal bone, and even the enlargement of mandible. So all the facial structures are enlarged. If you go into all these things, if you see acromegaly is nothing but a hypopituitarism. That is, there will be most of the structures in the facial body because of hypopituitarism. There is an enlargement. So this here you have to correlate these radiological features with the with the options. And here the given in the given pictures, it depicts the lateral cephalogram where all these structures are enlarged. So you can select the acromegaly. The following picture is a radiation personal monitoring device. So it consists of 3 symmetrical holes, each of them. So this is a TLD badge given here, and you have to remember for the TLD badge, the thing is it consists of 3 symmetrical holes, and each symmetrical hole will have a dimension of 12 mm. So you can select the dimension of 12 mm, and they are 0.0 mm thick and 280 milligrams weight, and it is a TLD badge which works on thermoluminescence. The image depicts which type of grid here. So there are 4 types of grids, and which is a linear grid, focused grid, and a pseudo focused grid. And the image given is of a pseudo focused grid here. In pseudo focused grid, you can see that grid height of strips is decreased progressively. See, you can see that grid height is decreased progressively from center, resulting in decreased grid ratio from center to edge. And if you see in the cross grid, the linear grids are placed right angle to each other. If you go into the focused grid, here the strips of lead are angled progressively, that is, they are with some angulation. Whereas in linear grids, the strips of these grids are placed alternatively, or parallel. So these are the type of grids used in the extraoral radiography. The given picture depicts a type of TMJ view in which central ray is directed at an angle of, you can see all the, this is the cranial view. You can see a few picture of cranium, ethmoidal air cells, and mastoid air cells, and few air sinuses. So this depicts the transcranial view, and in transcranial view will use an angulation of 20 to 25 degrees Celsius. 20 to 25 degree angulation can be seen. The following picture is it looks like a tooth slot, but it is not a tooth slot. It is a self-developing film, and in this film you'll have both developer and fixer. So first thing is you have to expose, and then you have to take that into the dark room, and you have to remove the packet of developer. Then after 15 seconds again you have to develop the remove the packet of fixer. So the finally the film will be developed inside the film packet only. At last you have to rinse the film in water and you can give the patient. So this is a self-developing film. The given image is a coronal view in CBCT. They identify the landmark number 1. So the first thing is ethmoidal sinuses. This is ethmoidal sinuses. The second thing is superior nasal terminate. Here the 8th one is sphenoid bone. 9th one is inferior orbital region. 10th one is perpendicular plate behind the ethmoid bone. 11th is coronoid process. And this is a section. 12th is a maxillary tuberosity. And 13th is a mandibular canal. This here. The given image is a CT brain. Arrow mark depicted as a feature of all the below. See, you can see this is called as a diploic space. And in this diploic space is mostly increased in all this thalassemia, acromegaly and hyperthyroidism. But this is decreased in the cases of osteopetrosis. So it is not a osteopetrosis. The following OPG may not be associated with. If you see the OPG, you can find multiple impacted teeth. So multiple impacted teeth are associated with Gardner syndrome, cleidocranial dysplasia and Noonan syndrome. Whereas it is not associated with the Ellis-Van Creveld syndrome. So option is Ellis-Van Creveld syndrome. The following extraoral view is, see here the patient mouth is open and you can see the condyle neck and the condyle clearly. So this can be of reverse tones view. In water view you can see all the air sinuses, whereas in PA and AP view we will ask the patient mostly to close the mouth. The following extraoral technique is mainly used for investigation of, so here the patient chin is touching and this type of view is of Waters view and it is used for the maxillary sinus. In this extraoral view, you can see that patient head is touching the cassette and the X-ray beam is passing through the base of the skull. It is nothing but a submental vertex view and here you can see the base of the skull. The following error is, you can see at this line, this is because of creasing. Creasing is nothing but it occurs in PSP receptors and it cannot be occur in direct digital sensors. This occurs in paralleling, bisecting or a Bite-Wick technique. When using a film, a thin radiolucent line is seen on the image. And if you use a PSP receptor, it will appear as a white line. The given landmark is, this given landmark is zygomatic processes which hinders the maxillary molar apices. Grid are preferred with a ratio of, so in extraoral, grids are used only in the extraoral radiography and the preferred ratio is 8 to 10. This structure is used for the protection of, you can see here, this is a lead collar type of thing and this is placed near the neck region to protect the thyroid gland. The given image is a radiographic appearance of, see you can see here a radio opacity and this radio opacity is hindering or obstructing the eruption of this third molar. So this type of thing mostly occurs because of the complex odontoma. And even the ossifying fibroma or periapical osseous dysplasias, as periapical osseous dysplasias, name indicates they are of nearly in the periapical region. But in ossifying fibromas, mostly we cannot see that unerupted teeth. But in compound odontoma or complex odontoma only, there is a obstruction for the eruption, normal eruption pattern. But if you see this radiopacity, it is very complex and you cannot find the structures like enamel, dentine. So you can go with the option complex odontoma. If it is a small radiopacity where you can see structures like enamel, dentine and pulp, if you can go with an option of compound odontoma. So, but for this radiographic view, it is a complex odontoma. The given radiographic appearance is not associated with, and this question is very tricky. If you go into the options All the three options are same. That means simple bone cyst is also called as a traumatic bone cyst or a progressive bone cyst. And for this all the things, the radiographic presentation may be of a unilocular radiolucency. So these three are associated with this type of radiolucency. And then you can select the answer that is like none of the above. Option D. The following faulty radiograph is due to. If you see in the radiograph, this streak, branching streaks is called as a static electricity, and this static electricity is mostly due to low potential electric discharge and occurs if the films are taken out with a rapid force from the film packet. So done with the radiology paper discussion, and if you have any doubts, you can ask us or you can ping us. Okay, thank you.